My name is Dr. Adam Farber, and I would like to present to you a video demonstrating arthroscopic removal of loose bodies in the elbow joint. In order to understand this video, you must first understand basic elbow anatomy. The elbow is composed of one upper arm bone called the humerus and two forearm bones known as the radius and ulna. When viewed from the front, the top portion of the radius is known as the radial head and is circular. This bone can rotate as it contacts the bottom rounded portion of the humerus known as the capitellum. The upper portion of the ulna in the front of the joint is an inverted V-shaped section of bone known as the coronoid process. When the elbow joint is viewed from the back, the top portion of the ulna is known as the olecranon process. This fits into a shallow notch in the bottom portion of the humerus known as the olecranon fossa when the elbow is fully straightened. When the elbow joint is viewed from the side, you can see there are two distinct compartments of the joint, one in the front and one in the back. In this figure, these areas are depicted by the purple color labeled joint capsule and joint cavity. Also seen in this figure is that on the ends of the bones at the joint surface there is a smooth Teflon-like lining known as articular cartilage, depicted by the light blue color. The cartilage allows the bones to glide smoothly over one another when the elbow joint is moved. When there is a loose body present in the elbow joint, it can be found in either the front or back compartment or may move between compartments. Here is a picture from an MRI scan from the patient in the video that you're about to see. A large loose body is enclosed by the yellow circle in the center of the joint. The humerus is seen on the top, the ulna on the bottom left, and the radial head on the bottom right. Here is another picture from the patient's MRI slightly further back showing two loose bodies again enclosed by the yellow circle. Surgery to remove these loose bodies in the elbow begins with the camera placed in the front compartment of the joint. Here the camera is placed on the inside looking across to the outside portion of the elbow. On the bottom center portion of the monitor you can see the circular shaped radial head, best seen here. Here the radial head is rotated around the rounded capitellum seen on the bottom right. Adjacent to the radial head you can see frayed, inflamed joint lining tissue known as synovitis. Slightly more medially you can see the inverted V-shaped coronoid process shown here on the bottom right. Next, a small shaving device is inserted into the elbow joint to clean up this synovitis to help postoperative pain and swelling and improve visibility. Note there are no loose bodies seen in the anterior or front compartment of the elbow joint at this time. Again, a more panoramic view, you can see the coronoid process on the bottom right portion of the monitor. Next, the camera is placed on the other side of the elbow and the coronoid process and synovium in this area are viewed. Again, there is mild synovitis, but no loose bodies are identified. Here the elbow is bent and straightened out and you can see the coronoid process sliding along the humerus. Then the camera is moved into the back compartment of the elbow joint and you can see there is significant synovitis present. This synovitis is removed with a shaving device to improve postoperative pain and swelling and also to improve intraoperative visibility. As the synovitis is cleaned out, you can see the radial head on the bottom left portion of the monitor, now behind the shaver, and the larger of the two loose bodies seen on the upper right portion of the monitor. There is the loose body on the upper right portion of the monitor and the radial head on the bottom left portion of the monitor. Here is a photograph showing the larger of the two loose bodies seen on the preoperative MRI, outlined by the red circle. Next, a grasping device shown here is inserted to remove the loose body in its entirety. Notice it is somewhat tethered to the surrounding cartilage. After the body has been removed, there is scuffing and fraying of the cartilage in the surrounding area. That is seen here. Next, a shaving device is inserted into the joint to clean up this cartilage scuffing and fraying and also to remove residual surrounding synovitis. As the shaver is turned on, the second loose body seen on the preoperative MRI becomes apparent in the center of the joint shown here. Another grasping device is inserted to remove this loose body. Here the grasping device is seen, retrieving the loose body in the center of the joint space. The shaver is then reinserted to remove the remaining cartilage debris as well as the overlying synovitis. The yellowish area on the bottom right portion of the monitor represents the origin of the two loose bodies and the underlying bone beneath the shiny white cartilage. Notice as the shaver is turned on, there was no additional loose bodies identified. Finally, the camera is repositioned to better inspect the radial head and capitellum from the back, as this is a common location for loose bodies. Here you can see the radial head on the bottom being rotated around the capitellum, and the cartilage in this area is pristine. Furthermore, there are no loose bodies identified, although there is mild synovitis seen. Here is a photograph showing the two loose bodies which were removed from the joint. They measure approximately 5 to 6 millimeters in maximum dimension. This completes the loose body removal procedure. Thank you for your attention.